Natalie, are there dangers for the NHS, for doctors as a whole, with the BMA, the Doctors' Union, saying that strike action is inevitable? We've discussed before, we've had back and forth about it. A lot of people can't get appointments. There is a lot of frustration with waiting lists. A lot of people are scared that the NHS won't be able to look after them as you have done over the years. Is this the right time to strike?
First of all, no one wants to strike. No doctor wants to strike because it will have an impact on the patient care that we're able to provide. So this is not something that everyone's jumping at going towards, but we're not being heard. The frustration of the profession isn't being heard. The fact that we have been repeatedly, year after year, being asked to do more for less. We're not being valued. We're not being valued in terms of our income. And we've already, it was a big statement to say, you know what, we actually deserve to be paid.
But doesn't everyone? The country's on its knees,
I agree.
Private sector pay is still, all newspapers like to say that private sector pay has gone up by more than public sector pay. Who reports the levels? The fact that private sector pay is less than public sector pay, as I just did, or the fact that public sector workers have much, much, much better conditions?
I'm not so sure that...
Oh, come on, final salary pensions. Final salary pensions, Natalie. Who gets that in the private sector now?
If we're talking about working conditions, the reason the NHS is struggling so much right now is because we are not retaining staff and we're not recruiting staff. How are we going to retain and recruit staff if we have low morale in a workforce where actually people are being asked to do more for less? So it all comes down to, of course, everyone is struggling. I appreciate that. Across all sectors, everyone is struggling. But if we purely focus on the National Health Service, we're in a situation where we are losing doctors. GPs are 1,700 less since 2015, when really we need 6,000 more.
A lot have retired early because they're, frankly, very well off, having worked the private sector and the public sector for years, having been trained at public expense.
That's true, but that's not necessarily the case for our current generation.
No, sure, but that's why doctors' numbers are falling off.
Not just why doctors' numbers are falling off. There may be some very happy retired consultants, fine. However, the majority of people are leaving early because they're burning out. They're not able to sustain working in that environment, working under those conditions. We're in a really tricky situation because the number of patients have increased by 16% per GP. Again, recruitment, retention is so key in order to improve working conditions and actually help with patient care. So, and it all feeds into each other. It's not just about pay, it's about actually how do we improve our workforce so that we deliver better patient care.